Hello, everybody. Just gonna wait for a few people to join us while I'm here. And as you come in, please like and share. Like and share.
Hey, it's that mama five, living life, feeling alive. From kids to culture, news to tea. Real talk, real life. Come vibe with me. That mama five, she's got the vibe. Yeah. Oh, 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 Yo, watching that Mama 5, where real stories meet real life. Hey, it's that Mama 5, living life, feeling alive. From kids to culture, news to tea. Real talk, real life. Come vibe with me. That mama five, she's got the vibe, yeah. Oh, 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 oh. Yo, watching that mama five, where real stories meet real life.
So, hello, everybody. Welcome back again. Happy Sunday to you all. How are you guys doing? I hope you're having an amazing weekend. If you guys can hear me, please do let me know in the comment section. And as you join, do not hesitate to like, share, and I don't intend to spend a long time here because based on the title there, you guys know what this live stream is all about. Happy weekend to each and everybody, and I hope you all are doing great. So, as you all know, my name is Wemimo, and I'm also known as Tax Mom of 5 and also known as TMO5 Kanduko. So, if you're new on my channel, you're welcome. You're absolutely welcome. And if you're a returning subscriber, thank you so much for always coming back. And please, as you're coming in, please like and share this video, or please like and share this live stream. So let's dive in straight into the story. So just a disclaimer first, okay? When I saw the story of Chimamanda Ngozi Adichie, when I saw the story of her losing a son, um, I was pissed, I was angry, I was upset. Obviously, you all know I'm a nurse, so hence why I'm going to be putting a disclaimer that though I'm a nurse, I have not been trained to diagnose or treat anybody. But obviously, based on my training and my current job, what I do, um, I think I'm able to put in a couple of opinion in regards to what actually happened. So I'm going to be just putting that disclaimer out there that no, I have not been trained to diagnose any sickness. I have not been diagnosed to treat anybody. I have been trained, however, to recognize symptoms in anybody, in either post-operatively or pre-op, or if you're out and about and you collapse, I know what to do. Or I see something, I see you and you have some sort of symptoms, I can assess you to come up to like maybe this is what I think. But then, other than that, I have not been trained to diagnose any serious illness. Okay, so when I heard the story of what happened to this Ngozi Adichie's son, um, I was pissed. I was pissed, but then let's go and read exactly what happened. The story. the story behind what happened. So I'm going to share my screen with you. Please, as you come in, like and share, and yeah, let me know if you can hear me in the comment section as well. I'm going to quickly dive into let's quickly read exactly what happened or what went down. Okay, so the story I saw is this. Let me start from where the story is. So I saw this post, obviously, as written by this person. Obviously, lots of the media houses have actually shared the story. And she wrote here that, according to her, I will never survive the loss of my child, Chimamanda Adichie said. And I would just want to use this opportunity to send my condolences to her. No parent deserves the loss of a child, especially for a parent who have been trying for so long. No parent at all, either a mom or a dad. No, nobody deserves the loss of a child, and it's even more painful if the death could have been something that could have been avoided or prevented. So my condolences to her and her family, and I pray and hope that obviously they've come out to share this sadness. I hope they're able to find closure, and it's going to be hard finding closure because it happened in Nigeria. So let's read through a few things that I found, and from there I'm going to chip in my opinion, the things that I know, where I think negligence is, or who should take the blame. Because at the end of the day, I've seen a few posts where the blame has actually been passed across to the mother, the parent, who is Chimamanda herself, and I was like, it can't be right. Why is blame being passed on the parents? But before we jump in there, let's read the article I've found so far. Okay, so based on the article that I found that's on your screen here, it continued. We were in Lagos for Christmas. In Kanu had what we thought was just a cold, but soon turned into a very serious infection, and he was admitted to at Atlantis Hospital. Okay, he was to travel to the US the next day, January 7th, accompanied by traveling doctors. A team at Johns Hopkins was waiting to receive him in Baltimore. The Hopkins team had asked for a lumbar puncture test and an MRI. So when I saw the lumbar puncture test, I remember I saw a post about a lady who I think it was recently shared on Instagram actually, who died recently after having a baby. I think it goes that she, not quite long after she had a baby, she was going through a lot of headaches or something, and then through the process of trying to figure out what happened to her, they had to do a lumbar puncture test. And I think if I'm mistaken, please let me know. And I think they did that for her to figure out what was happening. I think it was through the lumbar puncture test they were able to figure out that she had fluid build up in her brain. So that was that. I just remember that I read something that had to do with lumbar puncture test there. So apparently, they said that the Hopkins team had asked for a lumbar puncture test and an MRI. The Nigerian team had also decided to put in a central line. Hello, Anna's expression. Welcome. How are you, my sister? It's been a while. I've seen you. How you did? They did MRI. Yeah. So although doing a lumbar puncture test and an MRI, I want to believe that with needing a lumbar test and an MRI couldn't have been because the child has just something they called cold. I'm going to be very, very, I'm going to be treading softly on what I'm saying here. So according to her, they thought the boy had something, they thought he just had a cold, and he was to travel to the US the following day, and then the hospital in Baltimore were waiting to get him to receive him. However, they decided that the Baltimore hospital asked if they could do a lumbar puncture test and an MRI. So apparently, it can't be cold that child has. Don't quote me. This is just me, obviously allegedly. Anything I'm saying here is allegedly. Okay, so let's keep reading. So they consider that the Nigerian team had also decided to put in a central line. So central line is like a line that is actually put into one of the arteries that pumps blood into the heart. Most of the time, central line is always put somewhere around the neck, this area is a very, I don't like looking after a patient who has central line because you don't want to pass medication through the wrong tube. So with central line often has like four or five different heads, whereby you could use either of those heads to pass medication. There's a central line, there's a particular tube that goes straight to the heart. So there's like, they put one into your neck just there, and then it has like maybe multiple fingers, whereby either of those fingers can be used for medication. But if you're not properly trained to care for a patient with a central line, please, if you're not sure about looking after a patient with central line, before you pass any medication through any of those tubes, make sure you are asking from somebody who knows well, okay? So they put in a central line used to administer IV medications in preparation for Nkano's flight. Atlantis Hospital referred us to Iraqi Hospital, which was said to be the best place to have the procedures done. It turns out that Nkano was never monitored after being given too much propofol. And you guys know propofol is like a quick magic. It's like a smoke. You inhale it once, you're gone. Like you just take a full, once they put the face mask onto your face, once you take your full one breath in, that's you gone. I know this because I've had surgery before, and I know that's part of the things they use. And yes, as you know, I'm a nurse. This is what they use in putting patients to sleep. Okay, so it works like that. So it turns out that Nkano was never monitored after being given too much propofol. So when I read this part, I was raging because I knew that my department where I work, I bring a patient to pre-op, the anesthetists take over. I have been in the theater where a patient was being intubated, where they were being put to sleep, and they have to put an eye gel down their throat to help them breathe. And I know that before this patient can actually be put to sleep, the ECG is on, the 5-lead ECG is on, and the ECG is used to monitor the heart. The saturation probe is on to monitor your oxygen level. And then also your blood pressure curve. In most cases, if it's going to be a long surgery, they often put in an arterial line. An arterial line is a vein flon that is being put into your arterial vein, that is being put into your artery, and that line being put into your artery monitors your blood pressure by second, every beat that your heart is beating. That is what a central line does. Hello everybody. Oh, I see you, Mr. Roland. Long time. How are you? Happy New Year. I see you guys. Please like and share as you come in. So if it's going to be a long procedure, they often put in an arterial line. An arterial line just means that they can easily draw out blood if they need to go check baby blood sugar, if they need to go check whatever, they can easily take out blood. So it means that they're not puncturing you with needle every now they need to take blood. An arterial line is also good for monitoring your blood pressure by the beat, like every beat your heart does. Arterial line will monitor that, and it will be monitored because they will be monitoring all of that on the monitor. So you're using propofol to put somebody to sleep and you're not monitoring them. That is a big capital no. That is number one error that I've seen so far from what involved this child. Because as a nurse, I look after patients who have had surgery, and at times they could be in a lot of pain. And with two medication we give in recovery is fentanyl and morphine. Morphine we dilute. Fentanyl we don't dilute, we give it neat. And either of these two medications that we give via IV, it could potentially drop your blood pressure drastically. It could make you really, really tachycardic, or even make you feel bradycardiac, like you could be brady, you could be tachy. It could make your heart, your blood, your heart rate, it could drop your heart rate massively if you're sensitive to it. Or it could elevate your heart rate. It could do either of the two. So when we are giving, for example, fentanyl, we will put on a nasal cannula, we'll apply oxygen. If I'm administering fentanyl, if I'm administering morphine, any painkiller via IV, I often put my patients, put them on oxygen because it could either desaturate you, it could do a lot of things to you. So now a child was given propofol, and all of this medication, they are being given by measuring, by age, your weight. It takes calculations. They just don't apply. They just don't apply it. So for an anesthetist to have given too much, did he or she understand that it was a child they are giving this propofol to? Because in an adult alone, you have to monitor, not to talk more. A child, to the extent that you gave too much, did he or she, did the anesthetist miscalculate or what? I don't understand. So when I first saw that part, I was like, oh my God, you put somebody to sleep and you did not monitor them. Wow. So the article continues, the anesthesiologist had just casually carried Nkanu on his shoulder to the theater. So nobody knows when exactly Nkanu became unresponsive. That's a second major red flag, that things were just about to go bad. Where I work, if a patient has had a pre-med, so at times some patients might feel maybe they're anxious about coming in for surgery. So the anesthetist will often give them something to just make them calm down. So anesthetists might give them temazepam, they might give them midazolam and stuff like that. So once we go collect them on the ward, we often go with a trolley. We go with a trolley to bring them back, because there's no way you want to ask them to walk to theater or anything like that. So we collect them on a trolley. And if they've not been given any pre-med and they are in pre-op, if they are not on a trolley, the anesthetist cannot even put a venflon in them. They have to be properly placed on a trolley. So if they are not properly on a bed, like a theater bed or a trolley, we call it trolley. If they are not on a trolley, an anesthetist cannot even put in a venflon, talk more giving them medication to put them to sleep. So in my area, there's an area where we call pre-op. So that's where the anesthetist will put the line, the venflon, and then it is when they get into theater that they start to put them to sleep. So you sedate a child, you do not monitor them, you casually place the child on your shoulder into theater. So that's like a major emergency to happen. The article continues, how can you sedate a sick child and neglect to monitor him? Exactly. So it was even a child that was already brought in sick, and you were going to do all of that, and you were no monitoring. That's a major, like, I'm sorry. That anesthetist should lose their license. In my own opinion, they should lose their license. So let's continue. Later, after the central line procedure, and normally when the central line is done, they often do an X-ray to be sure that it's in the right place, because it could be in the wrong place, because when it's being done, the anesthetist just feel for the vein or the artery they are putting it through, and then once it's done, they get an X-ray done to be sure that it's in the right place. So I don't know if this is the same procedure I don't know if they did an X-ray after this central line was put in this child. So later, after the central line procedure, the anesthesiologist casually switched off Nkanu's oxygen. Hey! So they did a central line. He's already given the child propofol. Brand Network Food, welcome. How are you? Good evening, welcome. Hello, everybody. I see you. Please like and share. The anesthetist gave the child propofol. At least by then, they wouldn't have known if it was too much. And then casually carried the child on his shoulder without any monitoring. And then he or she casually switched off Nkanu's oxygen, and again decided to carry him on his shoulder to ICU. Why was the oxygen turned off? If you guys understand what I said earlier on about, even when I'm in recovery and I'm giving a patient a pain med via IV, I often put them on oxygen. Because like I said, it could dose medication. That is me even talking about fentanyl and morphine. I'm not even talking about propofol, because propofol will put you to sleep. Sleep that you cannot control. Sleep that it is the medication that puts you to sleep. It is medication that will wake you back up. So no oxygen was given to that child. A child that was already brought in sick. You've given propofol. You're not monitoring. You've casually carried the child on your shoulder without oxygen. I'm sorry, with all of these things, what happened to that child was meant to happen. With all of these things that I've read so far, these are steps that have been done wrongly, in my own opinion. I'm not a doctor, but I've worked alongside surgeons. I have seen the process of putting people to sleep. It is brand network, and that's why I'm like, I'm really not putting in my wow lens. Even this gele that I put on, I was not going to put on my gele because it's very, very tricky. I've had surgery before. The procedure was explained to me, so I know these things. I've worked alongside theaters in theaters with surgeons who do thoracic lung surgeries. I've been in a few surgical rooms, and I've seen how patients are being intubated. I've seen how patients are being put to sleep. Even before they even put you to sleep, there are so many things that are being put in place. So many things that are being put in place before they can even sign you up for that surgery. So reading these first few paragraphs, what happened to that child with all of these errors that have been done, that what happened to that child couldn't have been prevented because they've already, all the steps that I've read so far, if they've all been done wrongly. So the article continued, the anesthesiologist was criminal negligent. He was fatally casual and careless with the precious life of a child. No proper protocol was followed. We brought in a child who was unwell but stable and scheduled to travel the next day. We came to conduct basic procedures, and suddenly our beautiful little boy was gone forever. It is like living your worst nightmare. I will never survive the loss of my child. We have now heard about 2 previous cases of this same anesthesiologist overdosing children. Hey! So, if this is a criminal case, if they are pulling the anesthesiologist, they should be pulling the hospital as well. So he has had 2 previous cases of overdosing children, and he remained practicing as a doctor. He remained as I can't even pronounce English. He remained in that job role. The first case, the second case, and he still remained in that job role. And he was not investigated. And they allowed him to continue working to commit the third one. And again, another child passed away. So, why did Iraq allow him to keep working? Exactly. This must never happen to another child. If they had done something in the first place, this wouldn't have happened to this child. And I think I understand why, obviously, some articles that I've seen are blaming the parents, saying, oh, okay, if that child was sick, why did they need to do an MRI? Because like I said, it is not an ordinary illness. It's not an ordinary illness that they'll be wanting to do an MRI for, or a lumbar puncture test for. I want to imagine that this child has an underlying health condition. It cannot just be cold that this child has. That would now mean that the child is needing MRI done and is needing a lumbar puncture test done. It cannot be just cold. Yes, maybe they are in the process of diagnosing what the illness is. We will never know. And like I said in my disclaimer earlier on, I have not been trained to diagnose. But based on what I've seen here so far, that I'm reading, I just have to put in obvious. Like I said, I work alongside doctors and I see procedures being put in place. And I'm going to quickly cite a quick example of when I was going to get my gallbladder surgery. Hello, Ibla Megot, welcome. How are you? Brandon was said, I japa from Nigeria because of medical after living there for 8 years. Yeah, so Arikemi, I have seen articles where people were blaming the parent that, okay, you had the opportunity to get the child out, why not do it? But then again, I don't blame the parents in any way. They've done what was best for them to be done at that moment, get the child to an hospital, which was what they did. So all I've read so far from that article on the screen, I am putting the blame to the hospital and to the anesthetist because, like I said, protocol has not been followed. Like I said, if you're going to put someone to sleep, these medications are being applied. You have to calculate your weight, your age. Where I work, there are some medications that we don't give patients who are above a certain age. And if we are going to give that medication, it might be a smaller dose that we give. And then we don't give except the anesthetist prescribed it. If the anesthetist has not said, give this, we don't give. If the anesthetist say, oh, give the patient the medication, I'm coming, No, foul. No, it needs to be signed before we give it. So all of this medication, most of them, even IV medication, they have to be, measured and calculated based on your weight, your height, your age, underlying health conditions. Do you have any allergies? You have any sensitivities? There's a difference between being allergic to something, and there's a difference to being sensitive to some medication. For me, sitting down here, I am sensitive to ibuprofen. I can't take ibuprofen because if I do, it gives me stomach, it upset my tummy. That is not an allergy. It's not an allergy. It's a sensitivity to a certain medication. Exactly, brand network. I was wondering why they needed to do a lumbar puncture test and not do blood work. That was why I said it cannot just be cold that child has. Maybe that child has a known underlying health condition, allegedly. So let's say, for example, someone has heart failure and they traveled and they suddenly started developing some symptoms, and underlying health condition that they have, which is known to them, is heart failure, and you now see something different in them, instinct we grab that, okay, let's go to the hospital, let's run bloods. What could this be? I want to believe that they know I think there's something that this child suffers from, allegedly, and immediately, obviously, they thought it was cold. They took the child to the hospital, and for the hospital in Baltimore to be saying, to prescribe them, go do puncture lumbar test and go do MRI scan, it could have been because they want to investigate so that it is not what that child already has that is, flaring up. So a quick example to why I felt like the anesthesis is very, very culpable, is a criminal issue here. I was waiting to get my gallbladder out, and yes, I found out that I had gallstones just by chance. Nobody say I knew. Normally, I have abdominal pain back and forth here, and I've never thought of it. But that day, I just, I was like, no, I've had enough back pain for a very long time, and abdominal pain that I'm going to go to my GP. And I've always gone to the same GP, and this GP always, just ignore me. But this time around, I asked for a second opinion. And when I asked for the second opinion, the female doctor sent me for an abdominal scan. And when I went for the abdominal scan, and mind you, I've got 5 kids. So at times, any changes in my body, I don't keep quiet. I often speak to the GP about it. And yes, I suffer a lot of back pain. All of my kids, I had them without painkiller. Hello, Sister Idara, welcome. How are you? Yes, I'm going to be reading all of that. I saw a post as well, the same hospital. So because I've always had, obviously because I have 5 kids, and when you have 5 kids, I have all VJJ bats, no pain med, no nothing. So I have back pain. My back pain is continuous. So I don't joke with my body. So when the other doctor decided that I should go do an abdominal scan, it was when I went to go do abdominal scan. And then again, anytime I do a smear test, or if I do a cervical smear test, it often comes back abnormal. So if I have back pain, abdominal pain, I don't keep quiet about it. I go straight to my GP. Thank you, Brand Network. So anytime I have abdominal pain, even with the pain that I have, I don't get, some people have like serious menstrual pain. I've never had menstrual pain in my life. So anytime that I do abdominal, I do my smear test, it often comes back abnormal. Normally you go to your GP, they take a sample, then when the result comes out, it comes out abnormal. So anytime it comes out abnormal, they send me to the big gynecologist hospital. That, oh yeah, go there, let them go and do proper test. And when I go, I see a gynecologist, they do that and they're like, no, they are fine, they are not concerned. So that's why I say if I have back pain, abdominal pain, I go straight to my GP. I don't joke about it. So when the other GP now asked that, oh, go to abdominal scan. So I did the abdominal scan. That was when they found that I've got gallstones in my gallbladder. I was not having symptoms. And yes, that was not my symptom at all. So apparently, if you have gallstones, your gallbladder has to go, because they might think you're not having any symptoms, but over the years, you might start getting symptoms. And yes, I decided that I was going to get my gallbladder out because I found out that it could get inflated and it could burst. Yes. Just like appendix could burst inside of you, your gallbladder could burst and it could kill you. Yes. That was why I said that yes, I'm getting it out. And yes, it took me almost 6.5 years. I was first sent to a certain hospital. I was not sent any letter to come. Instead, they sent me a letter to come on the day of surgery, and the letter said I was going to be put to sleep. And I've never been put to sleep in my life before. You can imagine being sent a letter to come on the day of surgery and they're going to put you to sleep. I was like, no, I am not going. I've never had a surgery before. I need to know what's going to happen. Like, what's the process of you putting me to sleep and all of that. So I refused to go for that surgery. I turned it down. And then they took me off the waiting list, and I had to wait on the waiting list for another 4 years. In fact, I was actually going to go private to get it done. But just as I was considering private, I got another letter, saw another consultant, and then I got sent to another hospital. Do you know what this hospital did? They sent me a letter to come for pre-assessment. So that pre-assessment meant that I went there, they took a record, they took a history of my past medical history. What are you allergic to? Have you had surgery before? All of those things. They took bloods. They didn't do ECG because I was below 40 then. If you are below the age of 40, they won't do ECG on you. They did bloods. They asked lots of questions, and then I met with the anesthetist who explained the process to me. Like, what medication can you not take? This is a procedure. We will give you this. We will give you that. I said I can't take ibuprofen. We were like, well, we will give you ibuprofen. Hello, Vivian. Just to relax you. They use ibuprofen also to help the muscle relax also. So he said, oh, we are going to give you that, but if I notice that you're being sensitive or reacting to it, we can give you something, an antireversal for it. So I was happy to come to do the surgery even the following day. So I did pre-assessment. So I was assured that, my only concern is, will I wake up if you put me to sleep? And then after I did that pre-assessment, 2 weeks later, they sent me a letter to come for my surgery. So I went for my surgery without any concern, without any fear, because I know what the procedure would entail. Even on the morning of the surgery, I saw the surgeon, I saw the anesthetist who still explained the procedure to me. The surgeon told me it's going to be keyhole, 4 keyhole. We do this, we do that. You can go home in a few hours. I was super happy. So now, this procedure has been done on this child. No monitoring. Propofol, you're being put to sleep. And that was why I said propofol is very, very strong. Welcome, everybody. I see you. It's very, very strong. So for such to have been administered and then overdose, I'm sorry, that child wouldn't have woken up. With overdosing the child would not have woken up. And that was what happened. The child wouldn't have woken up because the child has already been overdosed already, giving way too much. How did that happen? Medical negligence, medication error. That was not the first time. That was not the second time. An absolute medication error. You gave all of that medication. You did not monitor the child. You took oxygen off. What for? Those were big errors that could never have been, retraced. And that was why I said earlier on that even fentanyl alone that we give in recovery, it could make your heart rate run from 50 to 140 if you're sensitive to it. Or it could drop your heart rate from 60 to 32. Or if your blood pressure normally sits at 140, you could drop it to 60s. And somebody gave a child overdose of propofol. Wow. Let me read your comment and let me welcome you guys. I'm so happy to see some of you tonight. So Anna's expression said, last December, my 4-year-old son had an infection here in the UK. Took him to hospital and they did blood work. These infection markers were high, almost 300. They will admit him straight away. Good evening, Sister Dara. I see you. Have you seen? Yeah, I've seen Tiana's post from the same hospital as well, which means there's something about that hospital. And for the fact that it has happened the first time, the second time, that also should have been investigated. Brand Network said John Hopkins is a top-notch hospital. But then I would imagine that they wanted to stabilize the child to be sure that the child was fit for purpose, or they needed to stabilize the child to be sure that it was fit for travel, because they said that travel doctors were going to go with the child. So I want to believe that this child must have had some major underlying health condition that maybe is under medication, he or she's under medication for, that they are able to know that is stable, but obviously being in Nigeria. There was a video of a YouTuber here who traveled to Nigeria with her 2 children. It was when her children started to fall sick, she decided that she was coming back to Canada. And I think I did a video, I reacted to it. So this family brought their family home. Their child fell sick, and now they're going back with just one child. Let me read your comment. Anna's expression said, my son did CT scan, abdominal scan, X-ray and lumbar puncture here in the UK. He had to go to the theater 4 times under anesthesia, and that will be under serious monitoring. My child has had a major surgery in this country. In fact, it was a spinal surgery he had. I was going to talk about it when we were going through that process, but my son said, no, Mom, I don't want you to speak about it. You want to see how much monitoring that was going on? And you guys know spinal surgery is not a mind surgery. He had a spinal surgery done. At some point, as a mom, I was like, no, I don't want him to have that surgery because he had scoliosis. If you know what scoliosis is, curvature of the spine, T4, T5, that was where the curvature was. If you see some child, when they walk, they bend. That was what my child had. That was what he had. And he had to reach a certain age before he could have the surgery done. If I tell you what went on in preparation before it was fit to do that surgery, you guys will be like, that one was 5, and you did not speak about this? It was a lengthy thing. And that surgery took 8 bloody hours. Everything that was done was under heavy monitoring. Blood tests, CTs, chest x-ray, bloods. That will be another story for another day if I'm going to share it. Fashion will I see you, Sister Vivian. I see you. Arikem said, I can absolutely relate. Nigeria have done me shege too. Wow. Brand Network said the child would have had respiratory distress. Absolutely. For the fact that it was placed on the shoulder. He could have struggled to breathe because that was a child. He could have even lost his airway. He could lose his airway. Place the child on your shoulder, which means that his chest. Oh my, I just don't want to. Vivian V said that was the same medication that acquired Michael Jackson. Exactly. People's life are at risk here. Adeleke, let me remove this comment. Fine. Adeleke, you want to buy me more gele? That's just my own style. I just thought something, to put a smile across people's face. That's my style. I know they go parties today, but I just want to wear it. Thank you. Brandon was saying, wow, thank God for you guys. Omo, for the fact that I had my surgery done, I was admitted 7 o'clock in the morning. By 12 o'clock in the afternoon, I was on my way home. I know of a sister whom we go to church together. She traveled to Nigeria to go get, I don't know what kind of surgery it was, but I think it was woman thing. She died. She died. She said she couldn't wait here anymore because she's been waiting for a while. So she decided to go do the surgery in Nigeria. She died. I don't know what surgery it was that she had done. She died. She died. Hey, Oluwakemi 671, welcome, my brave sister. Welcome. How are you? So Oluwakemi said, L115, first time on your live. Just a quick question about the gallbladder. Yeah, carry on. Ask your question. I'll read your comment. Let me know what question you have. Exactly. Why was the child placed on the shoulder? Is it that they don't have hospital bed? They don't have a trolley to wheel the child into whatever procedure they were going to go do. And I think the child was meant to have an MRI done. So apparently they need to sedate him so he wouldn't move a lot. See, even the use of propofol was not needed. They could have given him maybe a wee touch of maybe morphine or fentanyl. It just needs something to slow him down a little bit. There was no need for him to have been given propofol. They could have given him some sort of pain med that will slow that child down so they can do that procedure that he wanted to do. There was no need to even use propofol. Propofol was like, it's too much. Propofol was too much to have been given. Because at times when you first give somebody morphine or fentanyl, it slows them down a little bit. All of you latecomers, Shabi Maki or latecomer register, I am seeing you. Abi, president of the Gen Z, you are late. I will send you an invoice. There was no need to even use propofol for a child. Even a pain med, maybe how many meals could have slowed that child down? And how long is it going to take them to do MRI scan anyway? 15 minutes. Jera said, we love the game. Thank you. Thank you. Too, exactly. Welcome, Abby. Welcome back. Welcome, 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 everybody. So apparently there's much more. Just, it's sad, but that's that. And then now I saw a post, actually, another post where Iraqi came out to say something. That's the name of the hospital. So Iraqi Multi-Specialist Hospital empathizes with Chimamanda Adichie and family. So we extend our deepest sympathies to Chimamanda Adichie and family on the demise of their son and acknowledge the profound and unimaginable loss they are experiencing during this deeply distressing time. The loss of a child is beyond words, and we offer our most heartfelt condolences to his parents and the entire family. We find it necessary for the record to clarify that some of the reports currently being circulated contains inaccuracies, okay? Our facility is a reputable center for complex medical care, led by an internationally trained and experienced clinical team. The patient who was critically ill, can you guys hear that? They said the patient was critically ill. Abby said, one of my cousins is Iraqi something something. Okay. So they are saying that the hospital is a whatever. The patient who was critically ill, I'm of the opinion that this child allegedly has an underlying health condition that is probably being that they can control, that is under maintenance, that they are able to control whatever it is. So it just happened that it was when they visited Nigeria, this child decided to fall sick again. Like the Amanda said that they thought it was cold. So it's like somebody who has an underlying health condition like diabetes. So if something happens, you want to take a swift action. So that was why. So I think this child has an underlying health condition somehow, allegedly, okay? So they said was patient who was critically ill was referred to our facility for specific diagnostic procedures after receiving treatment for a period of time at 2 pediatric centers. Upon arrival, our medical team immediately provided care in line with established clinical protocols and internationally accepted medical standards, including the administration of sedation where clinically indicated. Okay, so if you admit sedation, was the proper procedure followed? Was the patient monitored? ECG, 5-lead ECG, oxygen on the patient, your blood pressure cuff on, your saturation probe on, so that you are monitoring the saturation to be sure that they are not desaturating. It was oxygen on. Was the ECG lead on to monitor their heart rate? Was any of that put in process on the child? Because that would be the proper procedure. You're putting somebody under sedation, you need to monitor them. Was this put in place? That's a question there that I would expect that they would maybe address in this article. In the course of his care, we worked collaboratively with external medical teams as recommended by his family and ensured that all necessary clinical support was provided. Despite this concerted effort, the patient sadly passed away less than 24 hours after presenting at our facility. We have commenced a detailed investigation consistent with our clinical governance standards and best practices. We remain committed to engaging transparently and responsibly with all clinical and regulatory processes. We recognize that the family is grieving an irreplaceable loss, and we shall continue to support them in any way that may bring comfort during this devastating period. As medical professionals, we carry the weight of this loss deeply. Our priority remains compassion, patient safety, and the responsible handling of this matter. While respecting the family's privacy and allowing due process to take its course, we continue to hold the family in our thoughts. So that was what the Iraqi hospital said there. That's that. And then, what did Chimamanda said? So I'm trying to go by based on the things that I saved so that I'm not missing out anything. So obviously, while that news broke out, Tiana's Empire said, Ura Care Hospital, your cup is finally full. Shebi, I told you people I don't have your time yet. Don't worry, just wait for me, I'm coming. So she wrote something here, but let me quickly read your comment. I think Abby is dropping a few comments there. So Abby said, no, let me read from Abby. So Abby said, one of my cousins is Urake something something. Okay, director of something. I should chat her up. Okay, Abby. Arikemi said, I have lost a child before. Oh, I'm sorry to hear that, Arikemi. I have lost a child before due to medical negligence in pregnancy. Was that in the UK or in Nigeria? I'm so sorry about to hear that, Arikemi. Anna's expression said they should first retrieve the license of their That should have been done the first time, because if they are now alleging that that was not the first case where he had overdosed a child allegedly. So that this child will be the third child he has allegedly overdosed. Was he investigated the first time? Because if he was investigated the first time, they wouldn't have allowed him to carry on for it to happen for the second child. When it happened the second time, was he also investigated? What action was taken? So Brian Network said we need to call out these hospitals in Nigeria. They have to be called out. And now they said this hospital is one of the best in Nigeria. They said it's one of the best in Nigeria. So let's continue with what Tiana's Empire. As we all know, Tiana's Empire, I think she's got some issues as well. So according to Tiana's Empire, every time I say if you have health issues in Nigeria and you make it out alive, just thank your stars. They feel the comment is to berate Nigerian hospitals. And I remember there was a time just someone also said something was wrong with she fell sick and they misdiagnosed her. It was not until when she came back into the UK that she realized that the diagnosis they gave her in Nigeria was not even closer to what was actually wrong with her. All they gave her was something to put in her nose. I think she was struggling from congestion or something. But Nigerian hospitals were giving her some sort of crazy diagnosis. So Tony said, I saw one Mumu person saying trash about me last week, all because I was speaking from experience. I just ignored. You go spend close to 100 million for hospital and then go still mismanage your health. They thought I was joking when I said I was going to sue, but I said they should just wait when I'm stronger. Most of these hospitals just front with the white people and the aftercare is shit. Still suffering the consequences from era care right now. Now another thing you go find go there, and another thing them go carry put for your hand. I kept asking myself why I did my spine surgery implant in Nigeria. You know what? When I was speaking about the fact that my son had a spinal surgery about 2 years ago, I was like, if it was in Nigeria, I don't know if I would still have my son. Because when I came across the story of what happened to this child, and when I saw that story of just Adetun as well, when she was misdiagnosed, only for her to come into the UK and all they gave her was a liquid solution to put in her nose or in her eyes to relieve her of the congestion she had. Like I was saying earlier, that my son had a spinal surgery, and that spinal surgery, it could have been prevented. We might not have had to do surgery because there was actually that curvature there when he was age 4. They did chest x-ray for him and they just abandoned my child. But over the years, he started to grow. It was when he turned 14, I was like, no, this curvature that this boy, like when he's standing this way. I was like, there's something wrong with this child. And I decided to take him to another GP. I said, I want another surgery. I want another a GP to assess my child. Immediately, that female doctor saw my son for the first time. She said, this is scoliosis. She said, Mom, for how long have you noticed this? And I said to her, I've noticed this curvature, like when my son, since he was 4, he bent, when he's standing this way, he's bending. And I said to the GP that I've noticed this since he was age 4, since he was 4 years old. So we've been carrying on. No, they say, oh, there was nothing wrong with him up until he was age 13. And then my son plays rugby. And I'm fearful for him, like, hey, this boy, rugby. It was when he actually became aware of his posture. I was like, nah, enough is enough. I now took him to another GP. I asked for another GP to see him. And I told her that, oh, since he was age 4. And she asked me, did he had any x-rays done? I said, yes, he had an x-ray done. So she found the x-ray. And within a week, my son was referred to a specialist, to a spinal specialist. We went to the children's hospital here in Glasgow. And we saw another specialist in the children's hospital. And the surgeon asked me, Mom, how long have you noticed this with his son? I said, since he was 4 years old. And he also asked me again, has he ever had an x-ray done? I said, yes. And he was like, let me check. He went into my son's medical record and he found the chest x-ray. The surgeon swore. He was like, what the F? That he could actually see that curvature there, that why did they miss him? So by then, my son was already 13 years old, which meant that assuming they've started treatment since age 4, my son wouldn't need to go through surgery. They could have started with, they call something body cast. They do a cast where you wear it to try and straighten him up. They could have started that. I've seen some babies who actually have body casts. So they missed my child up until he was age 14. And like I said, within a week, we were able to see the specialist in the children's hospital. Within that week, we were able to, brace, thank you, Brand Network. Within that 1 week, they said, oh, because it's now a severe case whereby it's actually restricting his lungs, which means that if he sleeps, You would think my son is not breathing when he sleeps. At times, I was always fearful. I would go and check him in his room to be sure that he's breathing. That was how curved his spine was. It was between T4 and T5. If I'm talking about T4, T5, the bone in your chest, not far from your heart, that's where the curvature starts. You will be sleeping, you would think he's not breathing. So when we now saw the surgeon, the consultant was like, oh, that we don't have any specialist in Glasgow that can take on my son. And he said the way he's looking at my son now, and because he's had lots of long tests, and that curvature was starting to actually impact his breathing. He was like, this is a serious case. I can't ignore him. I can't let him go home today without getting a resolution for you. And then he was like, Mom, I will get across to you in 24 hours. So the following day, he phoned me to say, we can't find any consultant in Glasgow, but would you travel to any hospital within Scotland? I said, yes. Within a week, they referred us to a specialist in Edinburgh. So my son received treatment for 3 years under a specialist in Edinburgh. So each and every time, every 4 weeks, we travel to Children's Hospital in Edinburgh for 3 years. They put him in a brace, and my son hated wearing that brace. The only time he's allowed to take it off is if he wants to shower, which meant that he could no longer play rugby. And me, I was happy that, oh, thank God, he's not playing rugby anymore, because that game is too deadly. It's too dangerous. I can't watch it. So we started that treatment, and I said he was finally diagnosed at the age of 14, scoliosis, and he had his surgery a day after he turned 16. If you see my son now, he's tall. He grew a couple of inches tall. And like I said, before all of that surgery was done at all, there were so many things that were put in place to prevent him from having the surgery. But the consultant was like, no, because that curvature is already impacting his lungs. And they were like, he had to get surgery done. You need to see how 4 consultants were arguing, like, no, wait until he's 18. One said, no, wait until he's 21. One said, no, as soon as he turned 16, he had to get the surgery done, because apparently there's a cavity in the chest of boys. When they grow past a certain age, then the cavity in their chest will have expanded. I think that's when they all grow so big that they are, So one of them, and one of the ones that I trusted the most out of those consultants, was the Asian doctor. That Asian doctor was good. I always believed in his instinct. It was like, no, when he turned 16, we will do another x-ray to see if that cavity in his chest has expanded. If it's expanded, let's go ahead with the surgery. The other 3 said, no, let him keep wearing the brace, blah, 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 blah. At the end of the day, they decided to go with the Asian doctor. My son had his surgery a day after he turned 16. And guys, it was not an easy journey. It was not an easy journey. You need to see him is a couple of inches taller now. He had that surgery, like, it was 8 hours. 8 hours that surgery took. And it was done in Edinburgh. And we were in hospital for 5 days. Come and see wires. I've never seen that kind of monitoring before, because I had to walk with him into the theater. Which was why I take my nursing profession very, very passionately. I take my nursing profession very, very passionately. When I give care, I give it passionately. I give it because I really, really do care. Because I know people going through surgery is a very, very life-changing thing for them. Now a child has gone due to the negligence of somebody who should know the right thing, but they chose not to do it. Right, let's keep reading Tiana's. So Tiana continues saying that till today, so she said, still suffering the consequences from Iraq care right now. Now another thing you go find, then another thing then go carry put for your hand. I kept asking myself why I did my spine surgery implant in Nigeria. Till today, I still can't speak well or walk well. I had complications, started bleeding in my lungs. I had to be taken back into the theater the next day to reoperate again. Before I know, I stopped breathing. They had to puncture my lungs and they destroyed my vocal cords. I remember a night I was given 2 injections and my heart ceased. Like, seriously, guys, I couldn't breathe. And then she tagged 2 people witnessed it. Her hubby had to threaten them. The trauma I faced in that hospital for months, I still can't get over it till date. I'm still in and out of hospital till date. Yeah, Tiana's empire is now in the UK. She has been in the UK for a very long time. I lost the use of my 2 legs after I was sent home, and I ended up back in that hospital again. I had to call the ENT doc in UK. He then told me to operate for the 3rd time to take the tracheotomy tube out from my lungs and see if I can breathe without it. Well, after that surgery, I was on the next flight the next day to UK with my family. When I got here, the doctors told me I had to redo another surgery again and said I had infections in my lungs. Oh my God. When they showed me the big lumps they brought out after, I was in shock. You mean after 3 surgeries in that same hospital back to back, yet I still had to have another one when I got to UK? It's just so shameful. For the fact that she had this surgery done, I would imagine that she must have gone private because she would have had to wait on the NHS. She will have gone private. She will have gone private. So she continued, it's just so shameful. See the statement, the statement is not said enough. Or is not said enough. Or if you have health issues in Nigeria, if you have money, run. Or even if you have money, your money can't actually give you better health in Nigeria now. Because this Chiamanda's family, she's doing well. And look at what happened. So Tiana continued with the second write-up for of our experience from the same hospital. So she continued saying, so after days on the tracheostomy tube urgent surgery, I needed to know why I couldn't speak at all. Because when I woke up, I saw my lungs had a big holes, which nobody warned me about. Achegu said he knew something was wrong because plenty doctors started running in and out of the theater. After the surgery, I had to write on paper to communicate. They said I should be grateful to God though, that I stopped breathing during the surgery and they had to open my incision from where they did the implant surgery to save my life because they didn't want to open another hole again. So, meaning I should be grateful to them. I said, okay, but why did I have complications? Why did I have blood in my lungs? Why do I believe she was the right edema. They didn't even notice my jaw getting swollen in the ICU. It was Ashegun who noticed and raised alarm that this jaw is too big now. I look like a monster with a huge sack jaw swollen and dropping before they rushed me for another MRI and rushed me to theater again. After all this drama, I needed to check why I wasn't still speaking. Guess what? They didn't even have an ENT doc on site. They had to take me to one old man in VI with their ambulance, which I paid for again, who did a painful test and who said I needed to downsize the trachea. He came to the hospital in the morning with no injections, nothing, with my clear eyes open. This man pulled out a whole big pipe from the big hole in my, oh my God, and put in a smaller one. My life flashed right in front of me. I could feel the air passing out from the hole in my lungs. I started crying. This man called me a crybaby. Weeks after, I was still in that hospital. Same thing, I was still asking why I couldn't speak. They then referred me to an ENT doc at Evercare. Their ambulance and nurse took me. Immediately, she numbed my lungs so she can carry out the test. The test lungs jammed up and I couldn't breathe again. They rushed me to their own emergency and had to perform a quick suction. When I was stabilized, did the test, and thank God for the ENT lady. She was the one who then told me that the trachea was placed in the wrong place. See? They placed the trachea in the wrong place. That's why I said even when they insert a central line, they often had to do, if anything is being put into your body, an X-ray had to be done. If you have a lung surgery and they put a drain in your lungs, they had to do an X-ray to be sure that the drain is sitting in the right place. Same thing if they put a central line in your body. Any foreign object that goes into your body, an X-ray has to be done to be sure that it was put in the right place. If you ever had a surgery where a foreign body is being put in your body and no X-ray is being carried out and putting this out here, tell your family to be telling them to request an X-ray. The only thing that I know so far that if they put in your body, you don't need an X-ray for is a urinary catheter. If they put a urinary catheter in your bladder, they don't need an X-ray for that. Because that one is straightforward. When you put it in, you can always know that, yes, the catheter is in your bladder to take out if you are retaining. If any foreign body is put in your body, maybe you had a cardiac operation where they have to put stents or they have to put whatever, you will definitely get an X-ray done. If you had a lung surgery, maybe you get part of your lungs taken out and they have to put a drain in your lungs, you must get an X-ray done to be sure that it's in the right place. Just like they put a tracheostomy in, they did not do an X-ray to be sure it's in the right place. They must have put, when you go through, if you study if you study the what's it called now, anatomy of the lungs, you will see that it is not just one tube that your lung has. Your lung goes in, is like a tree. Your lung is like a tree with different branches. So when they put that trachea, do they know which side? Is it the left side of the lung that they put it, or the upper side of the lung, or the lower part of the lungs? So they should have done an X-ray to be sure it's in the right place they wanted that tracheostomy to go into. So she could have died. So she said, thank God for the ENT lady. She was the one who then told me that the trachea was placed in the wrong place and my vocal cord were destroyed due to the emergency surgery. When I got to UK, they said it would take me 2 to 3 years to speak again, and it did. Even till now, there are days I will wake up and my voice won't come out, and don't even let us talk about the implants in my spine. The paralysis is back and the spine is still degenerating. Wow. So that's Tiana's experience there. Omo, see the Nigeria that I went to recently, I was praying that I should not fall sick. That was why it not be all the food I see for Nigeria they chop. I did not eat everything I saw in Nigeria. I was very, very conscious of what I was putting in my tummy because I don't want to fall sick. I don't want to ever have to be in Nigeria and fall sick. Yes, I had a travel insurance. I had everything in place, but God forbid, I was praying seriously that I don't want to fall sick. And I thank God that did not happen. So the Nigerian Society of Anesthetists breaks silence over Chiamanda's son's death. So they said here that obviously the Nigerian Society of Anesthetists says it is monitoring allegations of medical negligence. So yeah, they're investigating that. To say that its national president, Professor Mohammed, revealed this during an interview with the news agency on Saturday in Lagos. According to NAN, an official family statement that the 21-year-old boy in Kano Namdi, whom the novelist had with her husband, Dr. Ivara, died on January after a brief illness. You know, the patient will have a record, whether manual or electronic, that can be printed out. Yep, that's possible. Then there may be an independent investigative panel to look further based on the allegation, depending on if the mother or relatives want to take it further, Mohammed said. He explained that the investigation will focus on verification of the registration status of the individuals and facilities, compliance with approved scopes of practice, adherence to medical protocols, yes, and identification if negligence contributed to the incident. Mohammed said the NSA awaits more information before commenting further on the case. This is what they should have done the first time that this kind of case was ever reported about that hospital. This is what you know. This was what they should have carried out the first time. So I'm trying to read the statement by Chimamanda herself. Let's watch this.
We begin with the story of the tragic death of the 21-month-old son of Chimamanda Adichie. And reacting to the incident, Jurake Hospital in Lagos State says it has commenced an internal investigation following claims by award-winning author that negligence at the facility led to the death of our son, Kano Namdi. In a statement on Saturday, the Jurake Hospital expressed condolences to Chimamanda Adichie and the family, describing the loss as profound and unimaginable. The hospital emphasized that some reports circulating online contain inaccuracies about the incident. The hospital added that investigation will be followed clinical standard and best practices while reaffirming its commitment to transparency, patient safety, and support for the grieved family.
That's that. So I was just replying Anna. The Anna is asking, are they not supposed to use ultrasound to put in their tracheostomy? So when I was a student, I've seen one being put in. Some people are very, very good in the procedure whereby once it's in the right place, in the right lung, they can just tell it's in the right place. But still, you just don't go by your instinct. They often do like a pH test. So once they put it in, they will use a syringe to take out a liquid. They will use a syringe to take out a liquid from your lungs. Then when they take it through the trachea itself, they will use a syringe to bring out some fluid. So they will test that fluid. There's a pH thing that they use to test. So whatever the result turns out to be, we'll let them know that, okay, yes, it's in the right place. But in my own, with anything, I would rather a chest x-ray. A chest x-ray will show if it's in the right place. So that way there's no corner, there's no ngbati, there's no, I think, no. So when I was a student in an ENT place, there are people who are like that, they are specialists. They will just tell you straight away that it's in the right place. Or better still, before they even leave, they will just take out a sample, via the tracheostomy itself, test it with the pH thingy, check the results will show if it's in the right place. Or I would rather they do a chest x-ray. Chest x-ray is easy done. I would rather they do a chest x-ray. Marikami said, how can a trachea be placed and not check via an X-ray to be checked? Exactly. That's why I said now, you know what? Like I said, if you're having any foreign body put in your body, if you're having anything foreign put in your body, you have to check that it's in the right place. You have to check it's in the right place. You know, like where I work, we have looked after a lot of patients who have the part of their lungs taken out. I've seen people who do lobectomy, upper lobectomy, a lower lobectomy, right lobectomy, you know, part of their lungs or even half of their lungs, and they often come out with a drain. At times they come out with like 2 drains. At times they come out with 3 drains. We always do a chest X-ray before we discharge them. We do a chest X-ray. We are wait for the surgeon to come and see to tell us that yes, he's happy with the X-ray and we can discharge the patient. We don't discharge the patient until X-ray has been done and has been seen by the surgical team or the surgeon, he or herself. If neither of this thing has been done, the patient is going. In fact, what will tell you that no, they are not accepting the patient back until you tell them that X-ray has been done and seen as satisfactory by the surgeon or the surgical team. If none of that has been done, they will tell you that patient is not coming back to them because it's because of anything could happen. Anything could happen. So yeah, that's that from TBC there. And so it says here that Chimamanda Ngozi Adichie speaks out on son's death. So Chimamanda Ngozi Adichie, who recently lost her 21-month old, released a statement detailing the circumstances surrounding his death. Arise News reached out to Adichie's media team, who confirmed that she did author the statement. According to her representative, the message was originally sent privately to family members and a few close friends. My son will be alive today if not for an incident at Iraqi Hospital on the 6th of January. We were in Lagos, so I think I already read this already, you know, the fact that, you know, all those things happen. No, okay, let me read from there. I think this is the extended one. So we were in Lagos for Christmas. Nkanu had what we thought was just a cold, but soon turned into a very serious infection, and he was admitted to Atlantis Hospital. He was to travel to the US the next day, January 7th. I don't know why they just didn't take him. I don't know why they just didn't take him. They could have maybe just get him. I mean, he had traveling doctors who were going to be accompanying him. Why didn't they just take him? They could have just taken him. Maybe that's why people are blaming the parent instead of using it. But then it's Nigeria. There are specialist hospitals there. It's crazy. So, but soon turned into a very serious infection and was admitted to Atlantis Hospital. He was to travel to the US the next day, January 7th, accompanied by traveling doctors. A team at John Hopkins was waiting to receive him in Baltimore. The Hopkins team had asked for a lumbar puncture test and an MRI. The Nigerian team had also decided to put in a central line used to administer IV medications in preparation for Nkanu's flight. Atlantis Hospital referred us to Iraqi Hospital, which was said to be the best place to have the procedures done. Okay, the morning of the 6th, we left Atlantis Hospital for Iraqi. Nkanu carried in his father's arms. We were told he would need to be sedated to prevent him from moving during the MRI and the central line procedure. Like I said, they could have just given just a little bit of maybe morphine or fentanyl. That could have slowed that child down a little bit to even know. That could have slowed him down a bit. But I was waiting just outside the theater. I saw people, including Dr. M, rushing into the theater and immediately knew something had happened. A short time later, Dr. M came out and told me Nkanu had been given too much propofol by the anesthesiologist, had become unresponsive and was quickly resuscitated. Wow. But suddenly Nkanu was on a ventilator. He was intubated and placed in the ICU. The next thing I heard was that he had seizures, cardiac arrest. Oh my God. Oh my God. I've got goosebumps all over me reading this. All this had never happened before. Some hours later, Nkanu was gone. It turns out that Nkanu was never monitored after being given too much propofol. See, error number 1. The anesthesiology had just casually carried Nkanu on his shoulder to the theater. Error number 2, what happens to a trolley? What happens to a stretcher? What happens to even a wheelchair? Or what happened? No. So nobody knows when exactly Nkanu became unresponsive. Exactly because the baby was not properly placed in a proper hospital bed or trolley. If he was on a trolley, they could have monitored his breathing, they could have monitored his heart rate, they could have, because you can't sedate somebody. You can't sedate somebody with a propofol and you don't monitor them. Some people could lose their airways instantly. So even at times when you sedate people, they often kind of like, intubate. If it's, like I said, if it's going to be a long procedure, they often intubate them so that they are not breathing alone, so that they are not breathing on their own. But How can you sedate a sick child and neglect to monitor him? Exactly. Later, after the central line procedure, the anesthesiologist casually switched off Nkanu's oxygen and again decided to carry him on his shoulder to the ICU. Wow. The anesthesiologist was criminally negligent. He was fatally casual and careless with the precious life of a child. No proper protocol was followed. We brought in a child who was unwell but stable. Like I said, obviously the child was unwell but stable. That's one thing. And scheduled to travel the next day. We came to conduct basic procedures. I would say central line in a child is basic. It's not, because just like you said, that they have to sedate that child to make sure that you won't be moving a lot during the MRI scan. So central line is not basic, because even in adult at times, by the time they put a scapula to the neck and all of that, it's not a basic procedure. I'm sorry, it's not. If you're in the professional line, you have in a medical line, you will know that putting a central line, most anesthetists will avoid doing it. If it is not necessary, they avoid you doing it. They avoid doing it. They avoid it. So it's not basic, especially in a child. It's not basic. I just have to put that out there. And suddenly, our beautiful little boy was gone forever. It is like living your worst nightmare. I will never survive the loss of my child. We have now heard about 2 previous cases of this same anesthesiologist overdosing children. Why did Irake allow him to keep working? This must never happen to another child. That's a sad reality, that even if you are the richest person in Nigeria, this can
4 people have died following a crash between a car and a...
that this could still happen. It's so sad that this happened to this family. And I've seen posts that the Lagos State, is it the Lagos State government? See, yeah, these Lagos State governmental people, they are always doing eye service. They are always doing eye service. Not be today that we've heard of, emergency cases like that happening, that's happened at the expense of, that we've seen negligence, medical negligence happen to people in Nigerian hospitals. And I don't know how many of those cases where the Nigerian government or the Lagos State government has actually called out such hospital. But because of, I'm sorry, I don't want to sound insensitive, but because this lady, she's well known, they decide that, we're going to investigate. Look at the case of that guy the last time, that obviously his wife was pregnant and he had to take his wife to a certain hospital, and the hospital said if they don't deposit a certain amount of money, that they will not look after, they will not take the pregnant wife. Eventually the wife died. We did not hear that hospital was investigated, though. We did not hear, maybe the Lagos State government did, everything in Nigeria is selective. If you're not popular, if you're not rich, they don't always do things, So maybe if they are now doing the same for every other medical negligence cases in Nigeria, it would make sense. Because I'm sorry this happened to Chimamanda and her family, but things like this happens most of the time. Medical negligence happens in most Nigerian hospitals. It happens. What case did I see where I was speaking about? It was it last year or the year before, where a man took his pregnant wife to an hospital somewhere in Lagos, and yes, the woman had fibroid, but she was able to carry her pregnancy fine. So she was meant to have a baby via cesarean section, only for it's a cesarean section just to have the baby. And it was alleged that the doctor, after delivering the baby, decided to cut out the fibroid. Was that what she signed for? Was that what she signed for? So instead of just doing the cesarean section and bring out the babies, you brought out the babies and you decided to cut the fibroid, which meant that the lady bled to death. I don't think there was anything mentioned more of that case. The case just died down there. Now I've heard of another case of another one that's happened in Ibadan, that a husband, took the child with the wife to the hospital to have a baby. There's a lot of medical negligence cases happening in hospital, and I've never ever heard Lagos State government coming out to say, this is what we are doing. So everything in Nigeria is selected, just the way they did with the Anthony Joshua case. How many times have people been dying on the Lagos-Ibadan Expressway? How many times? But then because it happened to a Nigerian British, a well-known guy that suddenly, moving around with Nigerian politicians, they now want to investigate, and now they are now, there's a trial going on for the alleged driver. Like I said in my previous video, what happened to the driver, the Dangote truck driver who died, Fina's sister? Accidents has been happening on Lagos-Ibadan Expressway for years. How many people have been brought forward to say, oh, this was the person who caused the accident? How many of those cases have been investigated, but because it's Anthony Joshua, they decided to say, oh, we are investigating. Selective. At the end of the day, we are all Nigerians. We should be treated equally. We should be treated equally. Welcome, OJ. I'm going to drop the link here. Let's take a couple of calls. I don't want to spend just what I said I was going to be here for about an hour. Let's take a couple of calls. Let's see. Let's take a couple of opinions, right? Okay. I'm going to drop the link in the comment section. Anna's suspicion said, I did not supposed to use. Okay, I've already read that. Not at all. Hello, OJ. Welcome. How are you? Vivian said there was another one where the doctor said it was against religion to perform sex. So, oh, I did not even hear of that one. Can you imagine? Can you imagine? In fact, let me say, I think I saved a couple of other stories that I found about medical negligence that I felt like, okay, if the Nigerian government or Lagos state government are actually going to start doing something about this, then it should be okay. This one, let me share my screen with you. I found the story that I wanted to refer to. Let me share my screen with you. Share screen. I see a comment here. So Olasoribe said, as a practitioner in ER in the US, it looks like this child probably had a congenital issues. Okay, there are guidelines to prepare for Nigerian hospitals are the closest. Exactly, Nigerian. See, that's why I said when I went to Nigeria, I was praying that God, I don't want to fall sick. I don't want to fall sick. And it's also, maybe this is something that you guys should, I pray, none of us is obviously praying to fall sick, but if you're traveling, if you are from diaspora and you're traveling back home, please always have your travel insurance. No, it's not expensive. It's going to cover you for the duration of the time you're going to be in Nigeria for. God forbid anything happens to you, you'll be able to contact your insurer and they'll be able to provide you help, like either get you on the next flight out of Nigeria or send you somewhere. Don't just say because you are going to Nigeria, you were born in Nigeria. No, like me, I've lived in diaspora for 21 years. The first time I went to Nigeria, it was the first time that I went to Nigeria was in 2021. That was me after being in the United States, after being in the UK for 16 years. I ate suya. That was even before my surgery, before I had my gallbladder removed. I ate suya on the second night of arriving. That was in 2021. I was in the toilet for 3 days. I was in the toilet for 3 days when my plan was to eat every Nigerian delicacies. No, if the food was not prepared by my mom, I was not eating anybody's food. I was in Nigeria for 2 weeks. The first 3 days, I was in the toilet. I could not go out. And I just said, Mom, please, it is your food. I did not eat outside. Even fast food, I could no. And when I went again last year, I was a bit careful. I had all of my medications, Imodium, in case I had diarrhea. I had Imodium. I had all of my pain, paracetamol, dihydrocodeine, should in case, but still, I still had my travel insurance in place. God forbid anything happens. Because even now, medical negligence is not even leaving the richest people out in Nigeria. That's Nigeria. I'm sorry to say, Nigeria just happened to Chimamanda, and it's so sad that he had to take the life of a child. And yet, like I said, that this child, we don't know exactly what illness the child has, but I want to believe that this child has some sort of underlying health condition that they are able to manage allegedly, because something they thought was cold cannot just suddenly that they are needing lumbar puncture tests and stuff like that. So whatever it is, I'm not asking, they are not obliged to tell us, but the procedure taken by that hospital to get that procedure done for that child, they did not follow protocol. Like I said, that in recovery, even though fentanyl, we always administer fentanyl neat. We don't dilute it. We don't dilute fentanyl when we give it, because it's it's a quick acting painkiller via IV. Obviously, a patient who has just had, maybe they've just had their knee replaced. Normally, if you just had a joint surgery, you get spinal, you are comfortable. But some people, if they've been in surgery for a long time, their spinal starts to wear off and they might start to feel pain. So we might have to give fentanyl or morphine. So those medication, fentanyl, we don't dilute it. We give it neat. We dilute morphine because morphine is very, very concentrated. But then when we are giving these things, your patient had to have oxygen on. Even with oxygen on, I've seen cases where I've given fentanyl to a patient, their blood pressure was like 120 something systolic. Immediately I apply fentanyl, it dropped it to 80 something. The thing I did first, I stopped the fentanyl straight away, started with fluid, and I dipped the back of the bed. I dipped it down. And I said to the patient, I'm sorry, I'm not giving you any more of this. I am not. And yes, before we can give fentanyl, the patient has to have a certain threshold of pain before I can decide that, okay, this is what I'm going to give. Yes, it was because the patient had a lot of pain. That's why I said, okay, fentanyl is a protocol to go, assigned by the anesthetist. And normally we start with 25 mics, 50 mics, blah, blah, blah. We can start at 50 mics, but I'm not comfortable giving 50 mics. I always start with 25 microgram. Start slow. Because at the end of the day, I'm not in a rush to get the patient out. I just want to help the patient manage their pain. I'm not going to take away their pain entirely. You've had surgery, you feel pain, right? I've seen some people do 50. I don't do 50. I do 25 and then go like that. Even the 25 drop the blood pressure drastically, and I have to stop giving it. And yes, even that 25 that I gave was more than enough to help with that pain a little bit. So by the time when that blood pressure dropped, I hung bag of fluid, dipped the end of the trolley, oxygen on, and I'm like, no, you're not getting fentanyl again. I had to give a morphine-based tablet to say, okay, it's helped a little bit. So it could drop your blood pressure. It could either elevate your heart rate or, drop your heart rate. Those medications could do those. Not talk of propofol. Not talk of propofol. Brand Network said your stomach was adjusting to Nigerian food again. I think so, because this time around I went last year, I ate everything and anything. I ate all the street food. Yes, it said that they've got twins, so the child is a twin. Yes. Well, Vivian, those ones use, it could be, they could mix it. The ones on the streets, they would mix it, because the ones on the street, you are not sure if that is the original thing you are buying. They could have mixed it. But our own is a clinical one in the hospital. So, and those ones who buy it on the street, like I said, they could mix whatever it is. You don't know what they are mixing with it that they are selling for them. They will obviously want to make their money off it. So they will either mix something with it and sell it. So I know fentanyl is a big issue in the US. Street fentanyl is a big issue in the US. And yes, I've had patients who have totally refused me giving them fentanyl. They were like, is that not what they have an issue with in the US? I was like, but you are in an hospital. They were like, no, they refuse totally. And I'm like, well, if you are refusing, I'm sorry, I can't help you with your pain. And if they are refusing, there's an alternative. I could give them a morphine-based capsule or a morphine-based tablet. And why we give this morphine or fentanyl is because they are short-acting. They don't last long in the system. You give it, they work, wham, bam, and that's it. They don't stay quite long in the system. That's why we use it. So I'm going to discuss this case and then I'll round up. I've dropped the link. We can take a couple of calls. If not, I'll round up this case. Brandon was said mix with other substances. Well, the ones who are using it on the street are probably mixing with other things. Exactly. Vivian said, I see, just one if it's a different one. So that explains why I get exactly. So for us, if we give you, there's no chance of you getting addicted to it, because like I said, we are only allowed to give you 200 micrograms in recovery. And that 200 micrograms is about 2 meals. So it's not a lot. There's no way you're going to get addicted to it. Because like I said, it's fast acting and it leaves your system very, very quick. It doesn't stay long in the bloodstream for a very long time. So like I said, in total, maximum you are getting is 2 mil. And if I bring a syringe, I don't know if you're able to see that. That's probably all you are getting, because this is 5 mil. I don't know if you're able to see my syringe. That's 5 mil, and you're only getting the first 2 line, 2 mils. So if I put that in here, that's all it is. So we use a smaller syringe that you can give in micrograms. So this is a 20 mil syringe, and all you are getting is like 2 mil in total. That's all we can give you. We can't give you more than that. If you are still in a lot of pain, it's either we get you like a patient controlled it's like we get you a patient control whereby we do like a PCA, patient control epidural or whatever, and then you can press your button anytime you need. But then again, you can't overdose on that, because Every 5 minutes, it locks you out. You can't give more than what has been prescribed on that pump. If we think that your pain is going to be a long pain, PCA, yes, a patient controlled analgesics, we give you that. And then you are locked out every 5 minutes. So if you administer yourself, you are locked out, you will not be able to give yourself anything again for another 5 minutes. So there's no way you're going to overdose on that. So if we think that it's a long pain that, yes, you're going to be in a pain for a very long time, we give you a PCA. And then if we give you PCA, then we can't give you anything else at all. If you're going to give you anything, we either take the PCA off you and give you something else, or you stay on PCA and we don't give something. And in most cases, when we give patient PCA, we don't have to give them anything else, because once they go back to the ward, it can help them on the ward. And PCA, mostly we give it to patients who are going to be in hospital for a few days. So if you, like me now, I had my gallbladder surgery. 12 o'clock, they discharged me, because even me, I was already on my way out. I was already eating. I already went to the toilet. I had my surgery about 9 o'clock. By 12 o'clock, I was able to go to the toilet and all of that, and they discharged me. And I think I only had the hydrocodone. They only discharged me with the hydrocodone. That was all. And then I didn't even need that much pain. I was not in that much pain. So that's that. So this case is another medical negligence, okay? I think she's a popular TikToker or so. I'm not sure, but let's read this article. So it says here that as another popular TikToker, I think. So it says that greetings with the family of Esther Thomas, aka Sunshine. With pain in our hearts, we regret to announce the sudden demise of our beloved daughter's sister, who passed away on the 9th of January after an unsuccessful surgery. She had fibroid and was operated on, so she couldn't make it. So we are trying to put things in place so we could put her to rest for. You know what? I don't even know who's advising them to do a fibroid surgery. Me, that I'm sitting down here. When I fell pregnant with my second child, they found that I had my fibroids. It did not stop me from giving birth to my daughter. I fell pregnant with the third one. Maybe that could explain why I hemorrhaged when I had my son. When I had my first son, I hemorrhaged. I had a smooth pregnancy. Yes, I have fibroid, but then they were like, it's not huge. It's not something that they will operate on. That if it is below 2 centimeters or something, they don't operate. If it's below a certain centimeter, they don't bother touching it. Only if they could see signs of it causing your life havoc. If it's causing your life, if it's making your life miserable, they might consider, taking that. But if you're not having any effects or any symptoms with it, they don't touch it. So, but when I had my first son, I hemorrhaged. My pregnancy went well. I had my son, I hemorrhaged. I was in theater for hours, and they said they did not understand why I hemorrhaged. I fell pregnant. They often say that people who have surgery, people who have fibroid, that they will not be able to fall pregnant. All of my babies, I fell pregnant easy. I fell pregnant with my fourth baby. I fell pregnant with my fifth baby, and their pregnancies went well. Till tomorrow, I have never had any fibroid surgery. I have never had any fibroid surgery. If you're in the UK, anytime they send you a letter to come and do your cervical screening test, please don't joke with it. Make sure you're going for it. See, Anna's especially is saying here that she had 9 cm fibroid, but not inside her womb. I've been pregnant twice. I have 2 kids. My doctor asked me not to take it out as it's not. Exactly. That's why I said that if it is not causing you harm, they will not touch it. So I don't know why or who is advising Nigerians to go and be operating on fibroid. I don't know. I think the education minister in Nigeria should be advising. In fact, I don't even know. It's a bit this person that sabi what they are doing that will be able to advise you. If fibroid is not causing you, if it's not giving, it's not even meant to be life-threatening, but if it's making your life unbearable, they might decide to either start your medication to help you shrink it, but doing surgery, I don't know why people think doing surgery is the way out, because I don't know, I've heard that even if you do surgery, it can always come back. Ada said, the location of the fibroid determines how it affects one's ability to get pregnant. Yeah, you're absolutely right. So, like I said, I had all 5 babies. I never had an issue. Yeah, like I said, it could be why I hemorrhaged when I had my son. Yes, I bled. I bled a lot, and maybe that was when God saved me. Maybe I would not even be here today, because when the GP when the doctor came to see me, they were like, no, they can't explain how that happened. They do a keyhole, yeah. But then I know a few people who actually had fibroid, but they've never had it. Like I said, I have fibroid. I had fibroid, and I think the first time I heard being told I had fibroid was when I fell pregnant with my son, my first son, and I went to go do ultrasound, and they were like, oh, they could see fibroid there, they could see that. I think they said a couple or something, and they were like, if it's not causing me any issue, that they're not going to do anything about it. And then I've gone on to have two more babies after him. I never had any issue. I never had any issue. Ada said my gynecologist told me to have my kids before removing it, which I did in 2020 when it made me breathe uncontrollably. Okay. At least you are in safe hands. Most fibrous surgeries in UK are keyhole, always keyhole. So now this lady here apparently had had fibroid surgery, and she's no more. So it says that on 28th October, she was complaining of stomach bites. On the 1st, it got worse and she was hospitalized. A lot of scan was done, which the doctor said it was fibroid. The fibroid in her system has grown so big. Medication was going on at Orchid General Hospital. They were just putting her on pain relief without we knowing what the doctors were on strike. When I arrived, I noticed there was no doctor and nobody was there with her. I had to move. You can imagine they admitted a patient in an hospital where there are no doctors in the ward. Can you imagine that? When I arrived, I noticed there was no doctor and nobody was there with her. I had to move her from that hospital to her villa, where I went with the scan result, and the doctor started treating her. He said we need to carry out the operation so the pain will stop, which we later agreed on. The pain was getting out of hand. She did the operation yesterday. According to the doctor, he said the operation was successful, but she had complications which led to her death. What complication? What complication? So the lady is a content creator and she's also an influencer. Her name is Esther Thomas, aka Sunshine. So
on the second, because it was on the first that she was hospitalized. When I arrived, I noticed that there was no doctor and nobody was there with her. So there was no doctor. I asked one of the nurse, what is going on? Why is she still on pain? For like 2 days now, she has been here. She's still on pain. The nurse said the doctors are coming. Not until I found out that no doctor was there. I have to move her out from that general hospital to Havila Hospital, where I went with the scan result and all of that. And the doctor started from there and started treating her. Sometimes it will stop, sometimes it will start up again. And the doctor said we need to carry out the operation so that the pain will stop, which we later agreed on. The pain was getting out of hand. She had to just take it off. And she did the operation yesterday. According to the doctor, he said on the second, because it was on the first that she was hospitalized. When I arrived, I noticed that there was no doctor and nobody was there with her. The operation was successful, but she had complications which led to her demise. So I'm doing this video to let you all know that the lady you're seeing on the screen, Sunshine Esther Thomas, is late. The operation was successful.
And she's a very beautiful lady.
Please, I'm sorry. Wait, please, I need you. Come back to me.
It's so sad.
I bought this car for you. I've made a lot of money. I have money now and a lot of money for you.
They mad? Hello? No, they say she don't person. What they do you?
Pio?
So that's our Instagram handle there. It's so sad. Like I said, there's lots of case of negligence happening in Nigeria. And it's so sad that it's only when it involves an influential person or a popular person that Nigerian authorities seems to be investigating it. I wish this same energy that they are putting into this case of Chimamanda. I'm not trying to be insensitive here because at the end of the day, Nigeria is our home, right? So she felt they will be fine. She felt her family will be fine. That was why she brought them home. And this happened. So if they're now investigating this case, I would imagine that moving forward, any medical negligence that might have happened in an hospital, like the case of this young lady that died now. I would want to know what kind of complications she experienced. Like I said, there's been many more hospitals with lots of negligences that Nigerian authorities, Lagos government, I'm not saying they're investigating, but yeah, it's Chimamanda and her son, and they're now investigating. And yes, in my own opinion, the anesthetists, the hospital, they are culpable in this case. Not maybe because I know them or because I know better, no, but from what I've read, overdose, lack of monitoring, proper transportation of the patient. No, that's a lot. And for the fact that 2 cases like this has been reported under the belt of the anesthetist, I'm sorry, the fault is definitely in the hands of the hospital. And I'm super sorry that this happened to them. It just goes on to show that Nigeria, the way Nigeria is now, you can hear it from that guy there. No doctor in an hospital, and there's meant to be somebody who's being treated by a doctor. So who has been signing for the medication she has been taking? Who has been prescribing the medication she has been taking? Because it's only in Nigeria that I find out that they can just administer medication without the doctor even prescribing it. Here in the UK, you do it, you are a goner. You give a medication that has not been prescribed, you are a goner. You are a goner. So it's super sad that this has happened, and I'm hoping that hopefully now that they are going to investigate this case, now that the Lagos State government has obviously stepped in, that is going to be way of ensuring that we have a better healthcare in Nigeria. Like I said, you have money in Nigeria now. Your money is not going to save you. The money is not going to save you if you end up in a wrong medical facility. And I believe it's only God that heals. But then at the same time, let us be conscious of our health. And I know children can fall sick. I'm a mom here. I just shared my experience of my son having Brian Network said you won't be surprised that he's not even a real doctor. I don't think that such hospital will want to be associated with somebody that is a fake doctor. I don't want, if that happens to be the case, hey, I don't want to believe that hospital will want to be found that they have. I hope not. I hope not. I hope not. I'm so sorry that this has happened to this family, and may God give them the fortitude to bear the loss. And it's just sad. It's just sad. And if at the end of the day, if after investigating they found that this is the fault of the hospital, let them pay. Let them pay compensation, because at the end of the day, what actually annoys me the most when these things happen, when all of this negligence happen in Nigeria, is that there's no compensation whatsoever. Nobody is held accountable. That's what annoys me the most. That's what annoys me the most. There's a case of a young boy that went to Spain, and apparently he got lost and he died. Even though the accident happened while he was in Spain, his family are still going to get compensation here in the UK. They are. I've heard of cases of negligence, even that has happened here in the UK as well. The people are held accountable. Inquiry is going to be done, and it's not as maybe the money is going to bring the person back, but at least it will help the family with a little bit of closure. There will be investigation. Whoever is meant to be held accountable will be held accountable. There will be an inquiry as to how could this be prevented if it ever happens again, and then compensation is paid to the family. I say, okay, we are sorry this happened. We know it's not going to bring your family back, but Nigeria, nobody will say it is their fault. Nobody is investigating anybody. Nobody is going to say sorry to you. Nobody is going to compensate you for anything. That is why it's so annoying. That's why it's so annoying and frustrating. Brian Network said that's what happened with these BBL doctors in Nigeria. They don't have licenses. You know what? With all of this thing that's happening, if people are still going to go and be doing BBL, you are waiting, you are on your own. Whatever happens to you, take it because like I said, I know of somebody here who went, I don't know what surgery she went to do in Nigeria, but because she couldn't wait on the waiting list, she traveled to Nigeria to go get the surgery done. She died. I think they said that NEPA took light. NEPA took light. In the process, in doing the procedure, NEPA took light. And there's no standby generator. Well, guys, I'm going to end this live stream here. Like I said, I'm super sorry this has happened, but this is part of the issues we're having in Nigeria. I'm hoping that this case will be investigated. Whoever is accountable, whoever is responsible should be held accountable. And I pray that this family found closure, and may God continue to console the family. And I'm hoping that this is going to be a new era that if things like this happen in Nigeria, yes, as they are now investigating that, they will always investigate all cases and it should not be selective. And also, just my closing words to you guys: let us take our health seriously. Either you are in diaspora. On the 25th of December here, that me, I'm depressed that a Christmas in London, Christmas in Glasgow is too quiet, it's too boring. Somebody that I know was taking her last breath on the 25th of December. On the 25th of November, where I was in my own feelings, feeling that, oh, the street is quiet on Christmas Day, there's nowhere to go and be jolly jolly, there's nowhere to go and do parties. Somebody I know was taking her last breath. I don't know what happened to her, but I just found myself being added into some WhatsApp group, and then I saw a picture. She was somebody that I know, that she passed away after a brief illness, and I was like, what the F on Christmas Day? So please let us take our health seriously. You might think that, oh, that pain you have there is nothing. It might be nothing, but if it's on your mind, if you're constantly thinking about the pain, if there's something at all that you think is about your health, if you're constantly thinking about it, please get it checked. Please get it checked. You know, I did share my experience here last year. Was it last year before last year, where I thought I had breast cancer? I was in denial for like a week. And then I was like, come, I'm too young for anything to happen to me. My children are too young. I booked an appointment with my GP. And within a week of seeing my GP, she referred me straight away that day. Within a week, I was sent to the breast clinic. I had all tests done. All tests done. I got reassurance that it was not what I was thinking, that it was a cyst. And they put a syringe with a long needle like this. If you see the needle, they put it in my chest to drain out what it said it was a cyst. And they told me that it's a cyst. And normally it often happens during the early stages of your period or towards the end of your menstrual period, which means that you should always check on the first day of your period. I should always check at the end of your period. So in a new month, feel for your babies. If maybe you start your period on the 6th of the month, start checking from the 1st of the month to feel for anything. On the 6th of that you are starting your period, feel for your boobies again. When you finish your period, feel for your babies again. At the end of the month, feel for your boobies again. For me, I have to be honest, I don't check all the time. But in the past few days, to the run-up of me feeling what I felt, I was just taking my clothes off at work when my hand touched something. And then, if you see the kind of fear that gripped me, I was crying. And then I was like, it can't be. It can't be. It can't be. It can't be. Almost 5 days, I was in denial. By the 5th day, the Friday, I summoned the courage to call my GP. And the way nowadays, if you want to book an appointment with the GP, the receptionist will ask you, what do you need the GP for? Immediately I told the receptionist what it was, she was like, I will slot you for an appointment in half an hour. I called 8:30 in the morning. She called me back about 9:30 and she said, can you make it to the GP in 30 minutes? I said yes. And I drove down. My house to the GP is not far away. I drove down to the GP. She saw me, and yes, I've known this GP since almost 14 years now. Immediately she observed, she assessed me, she was like, yes, I can feel something there, but I don't know what it is. There's certainly a lump there. I can't tell you this is what it is, but I'm going to refer you straight away because of your age. I guess because of my age, I get to be referred quickly as an emergency. So I saw the GP on the Friday. I got a letter on the Monday, and I went to the hospital, the breast clinic, on the Wednesday. I went to that clinic at 9 o'clock. I did not leave there until 5 o'clock because they did series of tests. I did mammogram. I did everything. They took blood. And by the time they did a mammogram, they were like, okay, they were able to see what it is, that they don't think it's what I was thinking. And then they took 50 ml syringe and a long needle. They did not give me local. Hey, Zeno enter today. My runaway Gen Z member. Happy New Year, Z. It's good to have you here. And well done. They took a 50 ml syringe. They did not localize the area. They plunged it in there and drew out about 40 mils of fluid from the cyst. And they were like, you know what, they're going to test the fluid, but they are reassured. But even before they took me to the room where they were going to take out the fluid, there was about 4 of them in there. Fear catch me. And they were like, oh, don't be upset. Don't be upset that this is a trainee doctor. This is this. So they introduced themselves, and then they carried on with an ultrasound that they drew out, they drew out the fluid. And they said to me that, you know what, this is not what you are thinking, and they don't think it's cancerous. However, they're going to do a biopsy. They're going to test whatever they've taken out, and they'll get back to me. It was the longest 6 weeks of my life that I need to wait. And after 6 weeks, I got a phone call first to say there was nothing, that normally you get a cyst at the beginning of your period or towards the end of your monthly cycle. So you should always check. And yes, I was given the all clear. So let's check ourselves as women. Don't skip your cervical smear test. If you get a letter, there was a time, was it how many years ago? I will just realize that I've not had a smear test in how many years. I called my GP and they were like, oh, they sent me a letter. I said, no, I did not receive a letter. So they slotted me in to have it checked. And like I said, every time I had a smear test, it always comes back abnormal. And then they sent me to the big gynecologic hospital where they did, they open everything, they check. And I don't like that experience because every 3 years I always end up going there. So I think this smear test is every 3 years, if I'm not mistaken. Your GP will send you a letter. You go to your GP, your practice. I think it's the nurses that always do the cervical smear test. They take a sample, they send it away. If you don't hear anything back, you have to assume that it's fine. If it comes back abnormal, they will send you a letter to say it comes back as abnormal. And then in the letter they send to you, they will tell you that you've been referred to the gynecologist and your next appointment will be at the gynecologist. And most of the time that I've been referred, it's always within 3 weeks of me getting my smear test result back. I go to the big hospital, I see a gynecologist, and the last gynecologist I saw was a Nigerian doctor. Male, for that matter. A Nigerian male gynecologist was the one I saw the last time. I've always seen a lady. I don't know why I suddenly saw a Nigerian male gynecologist. But then I did not feel uneasy because there was a nurse in the room with him. So there was no unnecessary talk or anything like that. And in fact, it was one who actually advised me to when I was saying to him that I wanted to change my contraceptive, it was one who advised me to get the coil, the IUD. It was one who advised that, you know what, I will advise you get an IUD and stuff like that. And I've stayed on IUD. That's what I use. So yeah, let's ensure we are taking our health seriously. Check your health. If there's anything you're not sure about or you're concerned about, if that thing is nagging, if it's nagging at the back of your mind, please get checked. Okay. Vivia said the prolonged pills that stops periods. So when would be the best time to check? I'll just say check. So it depends. Just start checking a couple of days before you start your period, and check after the end of your period. If I remember clearly, that was what I was told. And you can also Google it as well to check, when best. So check few days before you start your period and check after, or better still, when you are in the shower. Feel for it. It only take a couple of seconds. If you are in the shower, feel for it. Maybe once a week. At least we shower every day. So if you're in the shower, just feel for it. It does not take that long. Feel for it. So please, let's take our health seriously. And yeah, that's pretty much I'm going to say. And also, when it comes to our children as well, don't let ignore our children's health either. I have a son here. Like I said, I share my son's story with you. If you see now, he's huge. It looks like those US basketball players. You know how huge they look. That's what my 19-year-old son looks like now. He's absolutely huge. He walks like a giant. And I'm super happy that, I was able to, insist on another doctor seeing him. And it's been 3 years now that he had that surgery and he's doing absolutely fine. They still do like periodical checks on him, I think once every year. So the last appointment he had there was him being transferred from the children's hospital to an adult clinic, which means that he is no longer when he was below the age of 18, he was in the children's hospital. Because he's now 19, he gets to go to the adult clinic. So yeah, he gets seen once a year at the adult clinic just to be sure that it's fine and all of that. So and one thing again, if you are able to afford that second passport for your children, please do it. I know immigration is crazy everywhere just now, but do it. Do it. That's just what I'm going to say. And if you're going to do it in a legal way. Okay? Do it in the legal way, because when I was going through this phase with my son, I was like, if I was in Nigeria, I don't think we'll have been able to afford all of this. Is it the cost of a treatment? Like, his treatment took 3 years. Is it the cost alone? Where would we start from? It's a different case if you find a specialist who knows what he or she is going to be doing. And then we can now source then the money. You don't want to be in a situation whereby they don't even know what they're doing. You don't know maybe that's the right diagnosis or anything. So, I'm super thankful. And it's just so sad that this happened to Chiamanda's son. And may God give them closure. Anyway, guys, I'm going to go. Thank you so much to each and every one of you who have been here. And just take care of yourself, okay? Just take care of yourself. If there's anything nagging you at the back of your mind, if it's constantly nagging at you, please get checked. Please get checked. Thank you so much, everybody. I really appreciate you all for being here. And before you click out, don't hesitate to subscribe and share. And thanks to those of you who have been engaging with all of my videos. I see you all. It seems that you guys are enjoying Aproko a lot. You guys are enjoying Aproko a lot. So the next video that you guys are going to get from me, possibly tomorrow, is another one of Regina Daniels and Neduoko, because Neduoko has released another statement. Yes, Neduoko has released another statement. So that's the video you guys will get tomorrow. So there might not be another live stream till Thursday, because I'm working Monday, Tuesday, Wednesday. I'm working 3 days in a freaking row this week. So I'm just going to try and drop sit-down videos, but there won't be live stream. There won't be live stream Monday, Tuesday, Wednesday. Maybe I'll be back on Thursday with another live stream, but I'll try and drop a couple of videos. So yeah, thanks so much, guys, and I hope we've all learned one or two things here. And let's take our health seriously, because at the end, even as a mother, in the past 3 years, I've lost 2 people here in Scotland that are mothers to young children, and it's always death after brief illness. It's super sad, but yeah, so let's take our health seriously, please. Let's take our health seriously. Anyway, guys, thank you. Let me go, and I'll see you guys later. Thank you, everybody who came here. I really appreciate your presence. And like I said, please share this video, and I'll see you again. You guys should leave my girl alone. This one is very, very soft. This was when I went to Nigeria. I had excess luggage. It was this gele. I came back with 15 different types of gele. Because when you go to parties here, they will say Ashwebi, but me, I've stopped buying Ashwebi. I just buy their gele. But this gele, at times, they are very, very hard to tie. So I took all of my geles from here. I took it to Nigeria. And I asked them to help me turn it to auto gele. So this is like a ready-made. I just tie it like scarf. Let me turn the back. See, I just tie it like scarf. So I've got 15 plus this one, 15. So nobody has any shakara to do for me. So if I'm going to church or going anywhere, I just have my ready, and they look so natural. You would think maybe I did this myself. You would think maybe I didn't do it myself. It's auto gele, ready-made. I just tie it. Thank you so much, guys. Thank you, Arikemi. Thank you. I see a lot of people have been asking about it. I wish I could sell it, but this is my own stash. It's my own stash. So I have like a peg in my storage area. I put it on the peg, and because I've got loads, the ones I wear, I just hang them on the peg, and then I stack them in a bag, in a bin bag, and I hang it off a hook. So that way, I know they're quite soft, so you can easily manipulate it, and it will be back up again. See, you can easily manipulate it, and then the shape still remains. So I put some in the bin bag, and I'm not storing it on the floor. I'm hanging it, so that way nothing is resting on it, nothing is pressing on it. So anytime I need to use it, I just go fluff it about, and then it looks pink. If it is those Ashoke, the Ashoke ones might be a bit, but these ones are the Sego ones, so they maintain their shapes. They do. Anyway, guys, let me go. I'll see you guys later. I'm hungry. I'll see you guys again. All right. Thank you so much, and have an amazing week ahead, everybody. Do you guys like the song that Uncle Beno made for me? Let me play that song as I go. Uncle Beno made me the song.
That mama fight, You're watching that Mama 5, where real stories meet real life.
One and only Mama 5. Hey.
Hey, it's that Mama 5, living life, feeling alive. From kids to
Oh, I'm living life. Okay.
Real talk, real life. Come vibe with me.
Come back.
That Mama 5,
Hey.
she's got the vibe. Yeah.
Oh, hey. Yeah.
You're watching that Mama 5, where real stories meet real life.
Hey. He's vibing. I'll see you guys later.